Excessive menstrual bleeding or menorrhagia is a common female complaint, and it may be entirely preventable by taking a simple capsule of ginger. The chief cause of functional menorrhagia, which is not caused by the presence of uterine fibroids or endometriosis, involves abnormalities in the biochemical processes of the endometrium, or the lining of the uterus. One abnormality that's commonly found is an alteration in arachidonic acid metabolism. This fatty acid is derived from meat and dairy sources, and it's converted to hormone-like compounds known as prostaglandins. The endometrium of women who have menorrhagia concentrates the arachidonic acid to a much greater extent than normal. This increased arachidonic acid released during the menstruation results in increased production of prostaglandin E2, which not only leads to excessive bleeding but also to menstrual cramps. Historically, the majority of complaints that ginger was concerned with was for the gastrointestinal system as well as for pain and inflammation. Ginger is generally regarded as an excellent carminative, a substance that promotes the elimination of intestinal gas, and an intestinal spasmolytic, a substance that relaxes and soothes the intestinal tract. Several double-blind studies have shown that ginger yields positive results in a variety of gastrointestinal issues, especially those related to nausea and vomiting. In regards to pain and inflammation, numerous clinical studies have supported this use with positive results in various forms of arthritis, chronic lower back pain, muscle pain, and painful menstruation. Ginger has been shown to produce equal results in reducing migraine headaches as the drug sumatriptan, but without the side effects like nausea, dizziness, drowsiness, muscle weakness, heart attacks, and seizures. It's also been shown to produce profound effects on prostaglandin metabolism, including reducing the prostaglandin that's implicated in the excessive menstrual bleeding and the menstrual cramps. In order to assess the effects of ginger on heavy menstrual bleeding, 92 young women aged 15 to 18 were enrolled in a double-blind study. These young women met the following criteria. They had regular menstrual cycles, experienced heavy menstrual bleeding that was clinically verified during the first 3 assessment cycles prior to the intervention, and they didn't have any of the following exclusion criteria. They did not have irregular menstrual cycles. They were not diagnosed with any gynecological disease like endometriosis or ovarian cysts. They were not taking regular hormone medications or non-steroidal anti-inflammatory drugs. There was no infection or pelvic inflammatory disease, and they weren't overweight or obese with a BMI of over 25 or underweight with a BMI of 18.5. The women took either 250 milligrams of dried ginger capsule or placebo 3 times per day, starting from the day before the menstrual bleeding until the 3rd day of the menstrual period. The women were then followed for 3 additional consecutive menstrual cycles. The results were determined by having the women assess blood loss through pictorial blood assessment chart with the following scoring system. 1 point for each lightly stained towel, 5 points for each moderately soiled towel, and 20 points if the towel was completely saturated with blood. 1 point for a lightly stained tampon, 5 points for each moderately soiled tampon, and 20 points if the tampon was completely saturated with blood. 1 point for small clots, 5 points for a large clot. For the 3 menstrual cycles prior to the treatment period, the average score for both groups was 113. During the treatment period, the level of menstrual blood loss dramatically declined during the 3 intervention cycles in the ginger by 46%, while the placebo group only dropped by 2%. The researchers concluded that ginger can be considered as an effective therapeutic option for heavy menstrual bleeding. There's a couple of other important considerations. The first is an iron deficiency. With increased menstrual blood loss, many women will experience low iron levels, and interestingly, low iron levels can increase the blood loss. Therefore, it's important to rule out low iron stores by getting a blood test for serum ferritin, an iron-binding protein that reflects the total body iron scores. Iron supplementation is indicated in any woman with a serum ferritin level below 60 nanograms per milliliter. The heavy bleeding is also associated with increased arachidonic acid availability in the uterine lining, so it makes sense to decrease the intake of animal products and to increase the intake of omega-3 fatty acids and other beneficial oils. So consume a higher intake of fish, nuts and seeds and supplement with fish oils, and this can lead to benefits by reducing the tissue levels of the arachidonic acid. To book a consultation or to learn about herbs, supplements and natural treatment plans, check out my website.